we've all got a stake in the performance of all of our organisations that work around here. So if you're really successful as one organisation, but your neighbour down the road perhaps is struggling, there's a mechanism in place now which means that if we don't help them out, if we don't ensure that they're able to meet their objectives just as well as we are in this particular organisation, then we're all going to fail. And I think what that will do is it will encourage a lot more partnership working between the organisations, not just in finance, but also in the way that we might share staff, the way we might organise the way that pathways work, how we share our expertise. If we can get more efficient in those areas, we can release those resources to perhaps pick up the things we're not doing so well at the moment, and maybe even do some things like get our waiting lists down, get our waiting times down. We can start to use the money in that different way. So the financial agenda for the NHS and for the rest of our partners across Lancashire and South Cumbria is not just about savings, it's about how we utilise the money better than we are now. And there are opportunities to do that. I think the takeaway message for the public and for our staff is that what we need to do in the health services and in public services is get the best deal for them in how we spend their money. And if we do that as a system, we've got more chance of being able to succeed than if we just leave it to individual organisations, and that's what we're focused on.